We are pharmacists in Oyo State, and this is our week. And as a result, part of our activity is the medical outreach that we are using to kickstart the pharmacy week. It ought to have taken place at the Olubadan's palace. However, as a result of what happened yesterday, we had to quickly look for an alternative venue close to the palace, and that's why we are here at the Skill Acquisition Center that is next door to the Olubadan's palace. We are here, we wanted to use it to commemorate the first anniversary of Olubadan's coronation and his 90th birthday. However, like I said earlier on, the Olubadan of Ibadan passed on yesterday, and we had to, as a result, we had to look for this place to enable us do the medical outreach. The medical outreach is meant for the community, for the Olubadan's immediate community, which is Yemetu, Aladorin area at Aremo. And it has been a fantastic exercise, and looking at the number of people trooping in, to come for the exercise, despite the fact of what happened. Our aim is for us to reach out, to the people through medical education, and public health, information, and as well as, for them to know the importance of pharmacists within their community. That's the main reason why we're here today.
My name is pharmacist Bola Oladokun. I'm the Publicity Secretary of the Pharmaceutical Society of Nigeria, Oyo State Branch. As part of our 2025 PSN Scientific Week, we are here today for the medical outreach at the Community Skill Acquisition Center, Yemetu. The medical outreach is part of our program slated for this week, and we have really made a lot of publicity concerning it, and so that we can reach out to as many people as possible around this Yemetu and Olubadan Palace area.
My name is pharmacist Olayiwola Babatunde. I'm the coordinator of this medical outreach. We are actually in our 2025 Scientific Week for Pharmaceutical Society of Nigeria, and as part of the programs we earmarked, we are here right now at a Community Skill Acquisition Center at Yemetu. That's beside the Olubadan's Palace, and we are here to actually avail the people at the grassroots here the opportunity to actually access healthcare at the lower level. Now, this is our registration desk. People have been coming in since 7 a.m. and this is the registration desk. You can see a lot of people. We started this since 8 o'clock and other things. Then from there, we take them to the next table, which is the vital signs. So this is the vital signs desk. This is where we take our patients' BP, and then we take their height and then the weight. So we have been doing this also since 8 o'clock. Then from here, there is another table. Okay, this is still a continuation of our vital signs table here and there, where we take the BP of everybody that come around, and then this is the weighing scale. We take the weight here, and then we also take the height there, so that we can use that one to calculate the BMI of the patients. Then from the vital signs desk, we proceed straight to our POCT desk, and this is where we do blood sugar, RDT, and some other things here. As people are coming in, this is how the flow comes to the POCT desk. Then from here, so this is the counseling desk. This is where we have our doctors attending to our patients. They do the clerking for them and then prescribe or intervene as necessary. So we have them here. Then we have the counselors also here, and also medical doctors also consulting here. Then when they finish from this desk, then we have another bench at the other side there. So the counseling session is going on as we speak right now. The counseling session is going on just to enlighten our patients more about their health status, so that they can be empowered about how to intervene at their local levels. So, and then this is a cross section of those that have been here since as early as we started, 8 o'clock, 8 a.m. So everybody is waiting to take their turn when it reaches them. And sincerely, what we find is that all of them actually appreciate this intervention. Some of them are checking some of their vital signs and some things about their health for the first time in 2025. So this actually helped them. And from there, we can be able to guide them on the next step to take if there is a need for them to go to a higher level of care. And then after this session, then we have this is our dispensary. So by the time you have gone through all the desks, and then if there is a reason for you to go home with medications, this is where it ends. And then we have a crop of pharmacists also attending to patients after they are done with the doctors with their prescription sheet. This is where they are also attended to, given the drugs. Then they are advised on how to take those medications, and then if there is anything that's like a close counseling, they also counsel there, and then from there they are advised on how to continue to manage their health, after which they can now go home. So we have them there. These are our colleagues, pharmacists, from this table, and then there's another table over there. So basically what we are trying to do is actually to also take this first level of care to the grassroots, especially the immediate community in this environment, Yemetu, very close to the Olubadan's palace. So that's actually our mission. So,
This is the park session.
okay. Yeah, this is one of the places where they actually make our drugs ready to be given to patients as the need arises. Is just to make those drugs available in dispensing envelopes as needed per patient. Multivitamins, analgesics, and the rest like that, so that the patients, you don't keep them waiting. So this is where you actually do the dispensing. Then we hand over to the people in the other table, so that they can hand over to patients with ease. So it's an impactful program, and the feedback from everybody that is benefiting or benefited so far is that they're actually happy that we bring this to their doorstep. So thank you very much.
My name is Okunze Mitchell. I'm a student of University of Ibadan, Oyo State. I'm at the PSN Medical Outreach, and there are different points in this place. Over here we have the consultation area, we have the point of care test point, we have the dispensary unit over here, we have the point where the weight and the height is being checked. Over here there are students of University of Ibadan at every point, and there are also consultants to attend to your needs. As pharmacy students, this is helping us to bridge the gap. So in class we are taught about hypertension, how to check blood pressure, we do the practicals among ourselves, but over here we are doing it on actual patients that need it. We're also carrying out blood tests for glucose. We're also dispensing drugs and labeling them appropriately, because without labeling you wouldn't know the particular drug you're taking, and you wouldn't know the dose of the drug to take. So we're also advising patients on how to take their drugs and how to be in good health so that they can have a better life.
I'm Dr. Mrs. Akimbami. I'm a Deputy Director in Pharmacy, Department of Pharmacy Usage. So we are here for the medical outreach, one of the programs for the PSN Scientific Week, Oyo State's PSN Scientific Week. So we are here to support the medical outreach team. The outreach is well organized. The flow is well organized, and many people are coming, and there will be so many, and their drugs. Thank God for the pharmaceutical companies. They've donated so much drugs for the outreach. So everything is going on smoothly. And thank God for the weather too. Everything is going on smoothly. Thank you.
Yeah, I'm Dr. Babala Matayodeji. I'm a medical practitioner. I work at the University of Ibadan. This collaboration of pharmacists to give back to the society is a way of giving back to society in order to come closer to our people, to know how they are doing and how to improve the lives of the individuals. At least I've seen different patients this morning. Some of them have not even gone to hospital in the last 1 or 2 years. This gives them the opportunity to come close to doctors. It might be due to some maybe financial constraint, but this outreach has given them the opportunity to know one element or the other that is been affecting them, and they are being treated for. And I think this is a very welcome program or outreach. And I pray God will bless the pharmacists for that.
Hi, my name is Dr. Olashuko Adiola, and I'm so happy and glad to be here to work with them. Thank you.
My name is Dr. Adeniji Agnes. I work with University Services, Jaja in UI. Well, I'm happy to be here to see patients and to attend to the patients' needs. Well, they are doing great. It's a very good and encouraging outreach. It's always good to extend your help to especially those that are less privileged. We have seen lots of people, most of them are hypertensive, some are diabetic, some don't even know they're hypertensive and they're hypertensive. At least with this outreach, they're able to know what their ailment is and being able to encourage them how to take care of themselves and to go for follow-up at their various hospitals.
Come and check my BP too.
I want to do 1 gram just for my
Dola Lanike Florence Seno from Oyo State Ministry of Health. So we are here to check their BP. So we are here to check the malaria parasite, the hepatitis. Then we are here for them to see doctors for their illness, for any problem they are having, so that they will be able to give them the drugs.
Aṣọ ẹlẹ́gẹ̀ rẹ̀ kò ní fàyà, aṣọ ológo rẹ̀ kò ní fàyà, aṣọ àgbẹ̀lẹ̀ rẹ̀ kò ní fàyà, ayé ò ní rí mú, ọ̀tọ̀ ò ní rí mú, ní orúkọ ti bàbá, ní orúkọ ti ọmọ, ní orúkọ ti Mósè, Olùmọ̀ládé. Mo fi owó orí mi mo fi sọ fún lónìí. Ẹ ṣe ewúrí tẹ̀sí ṣàdúrà. Mo fi owó orí mi mo fi sọ fún lónìí. Ní òní yóò máa lọ síwájú ní òní dèrò ẹ̀yìn.
2, 1, Oya.
Títí láyọ̀ Ìdòwú. Iye mẹ́tò òkè Aremo.
Òkèlè wá ṣe ń bì.
Àwa pẹ́ tó lera. Nígbà adé, àjókòó níbi tá a ti wọ́n kọ́kọ́ wa. Wọ́n ní ká lọ rá àwọn dókítà, àṣèfúnpá, àwọn. Wọ́n yẹ̀jẹ̀ wa wò. Wọ́n yẹ̀jẹ̀ wa wò tán. Wọ́n gbọ́ wa wọ́n gbọ́ lẹ́nu wa tí ń ṣe kálukú. Wọ́n béèrè. Wọ́n sì béèrè tán, wọ́n ní a lọ rí dókítà. Wọ́n sì fún wa lóògùn lóríṣiríṣi.
Ṣé inú yín dùn pẹ̀lú
inú mi dùn o inú mi dúró.
Kí la fẹ́ sọ fún àwọn tó ṣe gbogbo kíní fún yín?
Kódà
PSN.
ọwọ́ wọn máa lọ wájú wo ní rípa lára. Ogun èso ní borí wọn, wọn ò ní jẹ́ tí wọ́n wá lágbára Ọlọ́run. Àti tá a bọ̀ ní bá wọn. Ọlọ́run dà mọ́ wọn sí o, lókèlókè wọn mọ̀ lọ. Wọn ò ní ráàrẹ̀ o.
Èmi Kabiru Adéyẹmọ, mo dúpẹ́ wọ́n pè mí láti inú ilé bí wọ́n ń ṣe àyẹ̀wò ní òkè Aremo. Mo sì wọlé fírì, wọ́n sì fúnpá fún mi, wọ́n sì gbé ẹ̀ fún mi, wọ́n ní fúnpá mi dáadáa, wọ́n sì fún mi ní oògùn. Lágbára Ọlọ́run, mo dúpẹ́ iléeṣẹ́ ọsítù tó ṣerú ilé ọlọ́òdì tí ọba jẹ́ o, ọlọ́òdì wọn máa lò òkè sí o, ọlọ́òdì wọn lógun alákòóbá o. Gbogbo níbi tí mo fọkàn orí sí Ọlọ́run bá sí fún wọn, wọ́n tọ́jú wa, wọ́n sì ń gbẹ fún wa lágbára Ọlọ́run lágbára nábì, ọwọ́ yẹn máa lò òkè sí ni o.
Àwa pharmacist nílẹ̀ Ọ̀yọ́ state, àwa la ṣe ètò ìwòsàn ọ̀fẹ́ fáwọn èèyàn wa ní kó jẹ́ bí ọ̀nà táwa náà fi lè dá sí àlàáfíà àwọn èèyàn wa.
Mo kí gbogbo ẹ̀yin tí ẹ ṣiṣẹ́ yìí, agbádùn yín, inú wa ṣe dùn. Ọba mi ò ní forí gbàgbé ẹ̀yin náà. Ọlọ́mọṣà wọlá bí sánmà méjèèjì ṣe tó, gbogbo ẹ̀yin tẹ́ gbéṣẹ́ yìí kalẹ̀, Ọlọ́mọ fi àgbákò ṣe yín. Àgbákò tí máa ń ṣe ẹ̀dá aláyé tí máa fi ń lọlẹ̀, Ọlọ́mọ yìí ó dé báyìí.
I'm pharmacist Ipọ̀lá Ògúnyè, the fellow of the society.
The fellow of the society. I'm here to partake in these activities because we've been on this issue for a long time, and we don't have to leave the young ones. They are growing, and we are quite happy and impressed with their performance. So we have to be here, and in all the activities, we have to be present. I quite appreciate what they are doing, and it's projecting the good image of pharmacy.
I am Mrs. Motolani Akinkoye, a fellow of the society. I retired from University College Hospital 17 years ago.
So what's happening here?
Yes, to encourage, to help the public, to make them appreciate what pharmacists do. We are out to give them free medical treatments and to help them, to pay back to the society, to let them know our worth in the society.
Pharmacist Olajide Elemide, I'm an elderly pharmacist, and we are happy to be here. And we want the society to feel the impact of pharmacy. That is why we are holding this outreach, medical outreach. We want people around to know more the worth of pharmacists in the society.
Pharmacist Akinwande Babatunde Lukman, the former director of pharmaceutical services, Oyo State Ministry of Health. A pharmacist.
So what's happening here and what are you doing here?
Yes, this is part of Pharmacy Week 2025, medical outreach to give back to the community. We are here to support the younger ones that are growing, that they should see the way they are doing it and to give them the moral support.
My name is pharmacist Ramon Amido Oyewole, DC Farm MAW. Well, I am the chairman of the organizing committee of this Pharmacy Week 2025. And the aim of the committee and the organizers is to ensure that we put a kind of advocacy. Let people know what pharmacists are, what we stand for, and how they can benefit from our professional expertise. Now that you understand, drugs are everywhere. Even dogs carry drugs in Nigeria on charge. But how do we reach people to ensure that they get to the right place, get the right drug, use the drugs rightly, and have the benefit of the drugs they are using? Because every drug is a poison. If you use drugs very well, they become your friends and they give you the expected results to correct certain things in you. So people have misused drugs because they don't even know where to go, who and who to see. All these things are there. So it's one of those things that we come out and tell people that pharmacists are there for their health, and we are all available, and we should be contacted if they need any medical advice. And we look at the theme of the conference today, sustainable pharmacy collaboration. How do we now work with other health teams, doctors, nurses, lab scientists, everybody, to ensure that we have quality medical treatment for our people. It's very important. Here, I can tell you that the week has come, and we are on it, and we are very happy that we are doing it as expected of us. And I don't really, we expect that our aims and objectives will be achieved.
I need to appreciate the Central Planning Committee of this pharmacy week for for doing a fantastic job all along. Yes, tomorrow is our opening ceremony, but the energy to which this planning committee has put into the planning of this before we can get the result we are seeing today, it's been wonderful. So I cannot but thank them, and I pray that Almighty God will enrich each and every one of them in their various endeavors. Our sponsors, people like Enzo, Fitzin, Raffons, and Bond especially. They've been wonderful, and all and other companies, like so many of them that I cannot but mention. But one thing that we have done is that we have listed them on the brochure, and we really appreciate them. They've been wonderful. They've helped us so much. And also, I will single out the students of University of Ibadan, the pharmacy students of University of Ibadan. They are here all over, trying to help us. It shows that our tomorrow is guaranteed. The future of pharmacy is bright. I can tell you that, and I'm happy, to see them come around to come and assist. I thank the Dean of the Faculty of Pharmacy at the University of Ibadan, for releasing those students, to us to come and do, this, despite the fact that they have less than 1 week, to their exams. That is very, very happy. We won't forget in a long way to come. Thank you very much.
How do you say we are not used to it?
3, 2, 1, go. We are not used to it.